This patient came in with really bad pain, 9 out of 10, back pain that progressively got worse to a hip pain, knee pain, ankle pain type thing, then lots of headaches following this really bad trauma when she was in Hawaii.
This huge 20-foot wave came crashing down on top of me and took me through the washing machine, slammed me down into the hard-packed sand, took me back out, and then slammed me back down onto the sand. And by the time I got out, I could hardly move, and it was just horrible. My body just started pretty much going downhill at a rapid speed. I started having extreme knee pain. My hips felt like they were trying to separate against each other. My whole back, I couldn't do anything. I couldn't lift. I couldn't do anything. I couldn't function on a daily basis. It was a struggle. After a while, it just got to the point where I couldn't do it anymore. I couldn't go to school. I couldn't do any normal tasks that a normal 16-year-old girl usually does.
And she'd been to a lot of other doctors, and everybody said it was her growing pains because she was in cross country. We did an exam on her, found out that in her lumbar spine she had 6 vertebrae, which isn't uncommon, but that could have potentially caused some of the problem from this trauma. In that process, her body wouldn't do what it was supposed to do during cross country, so she was compensating a lot of different parts. The other piece of this puzzle is she had hit her head and her face, and some of that stuff was still lingering.
It got to the point where I woke up one morning, I went to go just lift up my backpack, and I couldn't move. I couldn't try to even get out of my bed was the hardest thing. It felt like my muscles were acting on their own, trying to rip my spine out of my back. Called up a few places, and they gave us Dr. Sheen's number.
So we went through a treatment protocol of 2 weeks. The idea was for her to get chiropractic care with some of the things that I do as a sports chiropractor, and also introduce her to craniosacral therapy, which is what one of my therapists does. And between those combination of those two, she went from a 9 out of 10 during the first day or two to a 5 out of 10 and eventually a 1 out of 10 after 3 treatments. After 6 treatments total, she was down to 0, and she's been pain-free ever since for the last week. And because of that idea, we did this combination of treatment, she got better. And in the last 6 months, she had gotten no relief at all whatsoever from any doctor that she'd gone to, and she'd been to a lot of them.
After about only 2 weeks, I'm completely over 200% healed. I am in amazing condition compared to what I was. I can do everything. I can go swimming, I can go horseback riding, anything, and nothing hurts my back or any of my body.
But these treatments, this craniosacral therapy, chiropractic adjustments, a little bit of Fenzian and some Graston work, those things right there, we were able to accomplish in 2 weeks, which she couldn't accomplish by herself or with other doctors for 6 months.